know that there's a lot of people sitting at home with back pain because they're not here and you're locked up in your home to stay away from the coronavirus. But I'm sure there's a lot of people who woke up this morning still having the same back pain. And so what we wanted to come on here today and show you a few exercises that you can do easily from anywhere, no equipment, no anything, nice easy stretches to help mobilize your lower back, to help get you some relief. We are here in the office. We've reduced our schedule. We're just seeing one patient at a time to help patients who really need to get in here to see us. But we're making sure everything's clean and sanitary, and everybody's using hand sanitizer, washing their hands, and all that good stuff. So if you're in Friendswood area and you are having severe back pain and need to come in, rest assured we're good and we're here for you. But you can do these exercises at home. So the first one actually that I wanted to show them is just the standing on the wall, the lateral shift. So in the lower back, we have 5 lumbar vertebrae. A lot of times we'll have patients who come in and they'll have pain just on one side of the lower back. So this is kind of just working to stretch the one side. If you're having pain, let's say in her instance, on the right side, you have 2 groups of muscles that go up and down both sides of the lower back. So if she wanted to stretch her lower back on this side, she would put her right hand against the wall and just shift the hips into the wall, keeping that arm straight and the upper body in place. Now go ahead, shift again that way. If you are having any symptoms that go down the leg, radiating, tingling, numbness, burning, sciatica, this is also a good exercise for that. However, if this increases any of the symptoms that do go down the leg, then we want to avoid that. Any of these exercises, these are good for sciatica, but if they increase any of the symptoms, then avoid that movement. You want to move into the position or the movement of comfort, into the direction of preference, it's called. Now, if you're having pain on both sides of the lower back, you can do that on both sides. The next one, go ahead and sit here. Easy, just a sitting exercise. We call it McKenzie Flexion. You're going to sit, knees kind of a little bit spaced apart so that you can reach down. This is a curling type movement. You don't want to just bend forward at the hips. Come up and show them just how if you were to keep your back straight going forward, how that would look. Good, right? So you don't want to do that just where you're keeping your back straight, just going forward. What you want to do is roll the back down, really as far as you can comfortably. Again, we're not looking to increase pain. You don't want to push through pain. I have a lot of patients who come in that say, that they've been doing some of these exercises, but they feel like, if they just push a little bit more, that would help relieve the pain. That's not what you do with lower back pain exercises. You move into that range of comfort, and every day you work to progress that a little bit at a time. Now, when you go down, do that again one more time. What I want you to do is reach between your legs and use your hands to really try to reach behind you. Don't just reach down and touch the ground. Of course, some people can't reach that far down. Now, put your hands on your knees, Jerica, and then push yourself all the way back up. If you have a problem doing this and you have a problem coming back up because the muscles hurt and ache when you come back up, put your hands on your knees and then just push yourself back up. Don't use your muscles to pull yourself. Now, let's do McKenzie extension on the elbows. So this, if going forwards hurt, then what we want to do is have you go backwards. So to do that, we'll have you lay flat and just go up to the elbows first. So you're going to leave the hips on the ground and you're going to come arch your back where you're supporting yourself on your elbows. You can hold this for about a count of 10. Just try to let your back relax and sink into the ground. Go ahead and push back up. So we'll do 10 to 15 of these, holding for about 10 to 15 seconds each. Again, with this is just mobilization. We're not really stretching. We're not strengthening for sure with this. We're just trying to get you a little bit more range of motion and comfort. This can be done really any time of the day, especially in the morning though. People wake up with lower back pain, part of the reason that we're coming at you early in the morning here. I read a study that said a significant percentage of people that injure their lower back actually do so in the morning within the first 30 minutes of waking up. You don't have a lot of blood flow going to those muscles, they're not warmed up, you've been down, feed the dog, brush your teeth, something like that, and then all of a sudden you've strained your back and you only bent down to pick up the laundry basket. But doing these movements really helps to get that back warmed up before you go on about your business for the day. Now, she's already progressed because she's tired of me talking. But what we're going to do here is now we're going to extend the arms to make that extension a little bit more. Again, leaving the hips on the floor or on the ground and push all the way up. Now, initially we're going to start with your hands out here in front of you. But as we get better, and again, this isn't increasing any pain in the back or down the leg, you're going to move the hands underneath your shoulders so that when you do come up, your shoulders go up higher and you have more of an extension in your lower back. Now, flip over on your back for me. So we're now going to do a supine, or on your back, trunk rotation. So you're going to have your knees bent up, feet flat on the floor, and extend your arms out to the side. So we're going to stabilize your upper body here on the floor by extending the arms out so that you don't have a lot of rotation here in the upper body and in the trunk. And she's going to just let her knees fall to one side and allow her pelvis to rotate so you get some rotation in the lower back. So we've done lateral flexion, side to side on the wall. We've done flexion, sitting, leaning forward. And then we've done extension, going backwards to the elbows, and extension to the hands. Now this is a rotational component. Again, all safe for people with lower back pain, sciatica. Again, if it increases any symptoms that are going down the leg, don't do that. And this feels good sometimes, so do that going that way again. Take your right hand, put it on your SI joint. And then she's going to kind of just push a little bit, do a little bit more of a forced movement. It's not quick, you're not pushing into pain, you're just adding a little bit extra stretch here. So, okay, now let's do CatCow. So I'll have you go like diagonal, like this, head here, feet there, good, perfect. So CatCow, again, is really a staple for lower back pain. You're getting both flexion and extension. You are pumping fluids to the lumbar discs. The discs are like jelly donuts. And the more you move those discs, the better opportunity they have to pull fluid back into them. So the CatCow is hands and knees. You're going to arch the back down into the cow position, and then you're going to arch the back up, and tuck the head down into the cat position. This is moving the lumbar joints. The lumbar joints are called facet joints. They fit together like two suction cups, and when you move, it helps move and mobilize those joints. Again, alleviating some pain on, could be possible disc pain, facet joint pain, mobilizing the disc and removing pressure on the sciatic or any of the nerves that come down and out and make the sciatic nerve. So we have a lot of success with these, right? And this is, again, just the initial easy exercises that we do here for patients with lower back pain, especially some of the acute and severe lower back pain patients. Try these if you've been watching and you want to know something else about any other body part. Obviously, things are slowed down right now because of our great coronavirus. And we would love to help you do some exercises at home. So if you've got something that's bothering you that you want to know more about, we've got the time to teach you. Just comment below and let us know. Neck pain, shoulder pain. I am a certified sports chiropractor, so we see a lot of athletes for shoulder pain, elbow pain, tennis elbow, golfer's elbow, knee and hip. What were we going to say? Knee, yeah, we do see a lot of runners and athletes. So if there's something that's bothering you, also on my Instagram page, which is Select Body Doc, we have an unlimited number of exercises categorized by body part. So if you follow me over there at Select Body Doc on Instagram and just look for the body part that you're hurting or that you want to know more about, just give that a look, and you can find a lot more information on there. But if you want to see it here on Facebook, let us know, and we'll be happy to help you. Thanks for watching. We'll see you soon.